everyone. Welcome to my session on Happiness Reboot, where happiness meets hustle. And this session is basically organized keeping in mind that how we can connect our life, that is our work-life balance, keeping trusting that happiness is most important than anything else. And talking about me, I am Devika Anand, corporate trainer and a certified wellness coach from University of California. So I always want to discover different paradigms of happiness. And today I'm fortunate enough to have with us Dr. Rahul Ghiya. He is a consultant neurocritical care at the Neuroscience Institute, Kolkata. So I welcome Rahul. Thanks for joining me
Thank,
for today's session.
thank you, Devika, for inviting me for this interesting session
Okay.
on happiness
So
reboot.
yeah, I hope it's going to be interesting because I'm going to get some insights from the doctor about happiness. So that's very important. Okay. So Rahul, can you just tell me that like today in today's world, work pressure is there with everyone, and in the corporate life, it is even more for students also, school, college students. It's not nowhere less. So how work pressure, gradually affects our happiness and eventually health.
Definitely, basically the thing is that in today's world, everybody is running about, and in the corporate world, as we all know, like in office culture, there's always a set target, and
Right.
the employees are crazy about meeting the targets, the meeting the deadlines. What is the his seniors are saying, the CEOs are saying to meet the targets. We also encountered many companies, RMO representatives, which comes and tell that so much target is going on, sir.
Right.
Please help us out. We are working till the late night. We are not able to sleep. We have
Right.
to keep the deadlines going on. Emails are coming up, and some of the representatives I see they are having a high blood pressure, and they are sweating. They
Right.
are having their difficult life, but still. So I just want to emphasize on the fact that this corporate office culture basically definitely take a toll both on the mental and the physical health on the
Right.
long. If it is a chronic and excessive burden, if they're having in their life, so basically they take a toll both on the mental and the physical health. So to talk about the mental health, basically subsequently what they will develop a generalized anxiety disorder. They
Right.
will start having panics. Ultimately, they will lead into either into bipolar disorders or they will end up into depressions,
Right.
and they will feel a feeling of burnout will be there, the irritability will be there gradually. So these are the mental aspect that we usually see. As I'm working as a neurocritical care consultant, we
Right.
always see in our OPDs or in the ICUs the patient land up into
Right.
such a generalized anxiety disorder or BPAD, which is called as bipolar anxiety disorders.
Right.
And when we inquired about them, one of the thing is there's the stress, maybe in the life, maybe in the workplace.
Right.
So mental health definitely is affected, and once the mental health is affected, the physical health is also getting a role.
Right.
Not every organs of our body get involved with this. So to start with, let us say about heart. Basically, the studies shows that the chronic office work culture, excessive work cultures, increases the incidence of hypertension by 2 times. And if the hypertension is too much, that will affect the cardiovascular system of the body, and the
Right.
increases of heart attacks are very much in these type of patients.
Right.
And we always see right nowadays that we are often see the young patient getting heart attacks,
Right.
40 year
Exactly.
old, 35
Right.
year old. They are so much into stressful conditions, because what does
Very
the
common.
stress does? Stress releases the cortisol.
Right.
So, and if the cortisol is very high, the all the basically the anxiety, the emotional stress goes up, and that ultimately leads to cardiovascular diseases. So
Right.
one of the basic things that we see is cardiovascular diseases. There are many rise. Second most common symptoms that we see in these people that they often present is with this having musculoskeletal pain,
Yeah. Yeah.
non-specific body pains. They will come up with like we see this chronic back pain, chronic
Back
neck pain,
pain. Right.
because they are having 10 to 12 hours of constant, they are on the laptops. Their poor postures are there, they are
Right.
not maintaining the ergonomics.
Right.
So they ultimately land up into having a slip disc, cervical slip disc,
Right.
they are having this lumbar slip disc.
Right.
Third thing that we most often see is that they complain of sleep deprivation.
Exactly.
Sleep deprivation, they complain of insomnia. They're
Right.
not able to sleep in the night. They're
Right.
constantly checking about their emails, if their
Right.
emails coming,
Exactly.
and they're having digestive issues. They are
Right.
not able to digest. They're having irritable bowel syndromes
Exactly.
and peptic ulcer disease. They're on rise.
Right.
And ultimately, all these things will lower their immunity
Hmm.
and it speeds aging in these type
Right.
of people.
Right.
And they see that whenever their weather changes, they are very prone to infections.
Right.
And ultimately, they will take leaves and they will again have to tell to their seniors that I'm not well. And again, they will increase the stress. That this cycle keeps on going on.
Right.
So there is very important that we should identify these symptoms as early as possible,
Hmm.
and we have to make a life balance, that at to
Exactly.
what extent that I can my body can push,
Right.
and we have and realize that we have to give certain time to our body to heal up also.
Sure, sure. That's true. That's very true. Because these days we see it's not just the heart, but every organ is getting affected. Like even
Yes,
like that you said that even digestive system or even back pain and all, that's also there. And one thing very unique that I've been observing is that people are exercising, they are fit also, but because of the mental stress that they are bearing, they are suffering from heart attack and all at the very early age, like 20s and 30s, 40s.
this is the thing, because they are pushing the body to their extreme.
Yeah,
The body is not prepared for that. They are working for 6 hours, and
right,
then they are thinking that they will not give the rest and they will hit the gym for 2 hours.
right. So
So obviously the
rest
body
to
is
the
not
body is
prepared for
also
that.
important.
The cortisol level is so high because they were so much in stress. They already the cortisol level high, and
Right,
ultimately they will go into the gym
right,
and hit it. And ultimately they'll make the muscles or more fatigue, and the
right,
stress level go keep on increasing. So they don't
right,
realize ki obviously they needs to rest their body also. They have to restrict the work time also, and then they have to keep on increasing the physical activity according to the body needs.
right. That's true. That's very true. So, any stress management hack you would like to give? Any way like you have
Basically,
suggested?
there are few steps that we can that should be doing in their normal life. There's one of 4 to 5 steps which I will like to emphasize. First is they have to set the boundaries.
Right,
Once the work has been done, they should say that basically they have to restrict themselves
right,
by stop checking their emails once they are home, and they should be that they are able to say no if they are feeling overburdened, if they are feeling over worked. So they should be able to say that no boss, I cannot do it more, please.
right.
So
Sure.
first they have to set the boundaries. Second is that they have to prioritize movement. If they are thinking that they have been sitting for a very long time,
Hmm.
so every hour they have to make sure that I should get up at
Right.
least in 1 hour or 90 minutes. They should get up at least for 2 minutes.
2 minutes.
They should stretch their back.
Right.
They should relax their mind.
Sure.
That could also help them. Third, they can do basically the third thing that they can do is they can go for a deep breathing exercises.
Right.
That will definitely help. There is a rule which is known as 4-7-8 rule, in which what we do that we inhale for 4 seconds,
Okay. Four, seven,
then
eight.
we
Okay.
4-7-8.
4, 7, 8. Okay.
Basically,
4 we do
we inhale
inhaling.
for 4 seconds,
Okay.
then we hold the breath for 7 seconds,
Hmm.
and then we exhale the breath for 8 seconds. We
Okay.
can do it for one nostril one time, and then we can do it for the second nostril that
Okay.
time. And we can do the repetition for 4 times. So that will
Okay.
hardly take 3 or 4 minutes.
Sure, sure.
But that
They
what will
can
they
do
will
in
do?
the
They will
office also.
ultimately what will they will do? They will ultimately cause the parasympathetic stimulation of the body.
Right.
And if the parasympathetic stimulation will be done, they will decrease the cortisol in the body.
Okay.
What did happen now
Okay.
when whenever the person is working in any stressful condition, their sympathetic activities come up.
Right.
There is increase in tachycardia, there is increase in respiration, they are
Right.
more focused on the burn. So once we do the deep breathing, what they does, they stimulate the parasympathetic part. That will induce the calmness, that will decrease the cortisol level in the body, and that will ultimately produce calmness in the mind also.
Calmness.
And
That's
fourth
very
thing is what they can do is that they can optimize their work. They should prioritize the work.
right.
Prioritize the work. They should be able to know that this work is important. These need extra time,
Right.
and that work can wait.
Yeah. So it's kind of time
Another thing
management
was
they need to
and
do.
one thing which I really want to talk about is sleep and the nutrition.
Sorry?
Sleep and nutrition.
Sleep and nutrition. Yes.
Obviously, the sleep is very important. They should ensure that at least they have a 7 to 8 hours of sound sleep,
Right.
and this sound sleep should be maintained throughout the week. So sleep cycle should be maintained. Sleep discipline should be maintained.
Right. A sound sleep of 7 to 8 hours is important for a healthy body. That's
Definitely, it is available. Basically, there are many studies which has come up, and many of the motivational speakers, if you see also, if health coaches also sees also nowadays, doctors you see also, they will always focus that 1/3 of your time of the day should be there to make your body mind relax,
right.
and that can only happen when you have a very sound sleep.
Sound sleep. That's right.
And nutrition, obviously, you have to try to have a balanced, rich nutrition, which is good in every aspect, including the protein.
Right.
And nowadays, what we see in our office cultures is that the people are craving just on coffees. They are just
Right.
having black coffees, and
Non-stop coffees and tea and
a lot of black coffees. But
yeah.
I must say that one black coffee usually stays in the body for 6 hours. If you're
Okay.
having a black coffee around 6 p.m., it will keep your mind activated till 12.
Okay. So I think then their sleep is like gone completely if they are
Yes, yes,
consuming
yes.
it in
So
evening
it
or
is very
something.
important that you should not take black coffee at least 6 hours before the sleep you want to have induced.
Right. So at least it should be avoided by evening. After
After 2 p.m.,
afternoons,
it's
it
better to
should be
avoid.
avoided.
After 2 or 4 p.m., it's better to avoid it.
Right.
And another thing is that social support is very important.
Right.
If the person is seeing that he is getting frustrated, he's getting burnout,
Right.
so he should go to his friends, he should
Right.
go to his well-wishers, he should able to speak what he is thinking about. He
Right.
can even see a therapist also.
Right.
So it is very important that he go and speak about the things,
Right.
because until unless he doesn't speak, the stress will keep on coming up, and ultimately he will go into either depression or develop a severe anxiety.
Because there is a misconception in our society that for to a therapist, a person who goes is not a normal person or something. But I think everybody faces some or other level of mental stress and all, which can aggravate if we don't consult a psychologist or a
Definitely,
therapist.
definitely. Even after the COVID,
Yeah.
once the rise, there was a tremendous rise in this psychiatric and psychological issues.
Right.
The people were bound to stay in the houses. They were people were
Right.
bound to work on laptops for a
Right. Hours on
tremendous
end.
hours of end of time. They have to meet the targets. They were not able to see the nature. They were not able to go out in sunlight. They were not
Right.
able to mingle about with their friends group.
True.
So there was tremendous rise in this psychological and psychiatric issues.
Right.
So it is very important to have a good social circles. It is very important to be close to the nature. It's
Right.
very important to be have a nutrition diet. It is very important to have a sound sleep.
Right.
So these are the some of the strategies which every person can do in his daily life.
Right.
It's nothing very expensive that we are asking for.
No, it's something which is very important, not expensive. It's
Important.
free of cost. Only thing is that we have to think about it. Like being mindful of all these things is very important.
Yes, yes.
Yes. And one last question I just want to ask you that you are working in, this critical care yourself. So you see that life is very fragile,
Yes.
things. So people don't understand this thing and then they think about so many things, materialistic life, all this. So that steals away their happiness eventually. So what is your suggestion as a doctor, like how they can focus on their happiness by being a little less materialistic in their life and thinking more practically that it is good that they are healthy and they are living in a good, healthy condition. That is more than enough, I think.
Yes, yes. For this, I remember one of good quote by a motivational speaker
Right,
that they say that stop identifying your mind and start
right,
practicing the power of now.
right,
Until unless you are start keep on identifying your mind, ki, I am not able to getting this, I have to make the targets, why the people, why I am doing so much of work, the other people are not doing that much
Right.
work, they are moving around, they are going around. So you will not find the eternal happiness in your life.
Right.
Until unless you should live in the present, you should
Right.
see what the situation you are in right now,
Right.
and start focusing on the small things, the small happiness.
Right.
Even if you are walking in the sunlight for 30 minutes, will can give you happiness. Even
Right.
if you are watching if you like to see listen to music, taking a deep breath, seeing going into a social group, having a group of friends.
Right.
So if you can give you a good amount of happiness that can stimulate your dopamine, can decrease the cortisol levels, can stimulate the
Right.
serotonin levels, because
Right.
it's all about the hormone balance that we are
Hormones.
thinking
Yeah.
about.
Hormonal balance. Right.
So it's not about that you have to chase your dreams, keep on chasing your dreams, and just getting frustrated of not achieving them. It's
Right.
about realizing that what you have in your hand and the small happiness that you can look around.
Right.
Because as a critical care consultant, every day I'm seeing the life is so unpredictable.
Right.
Yesterday the person was fine, he met with an accident, now he is on
He's,
the deathbed,
yeah, he's in danger.
and it's all destiny. You cannot change it.
Yeah.
But at least whatever life you are having, you can relish it. You can
Right.
thank to the God that they have given you this kind of life, and you can achieve happiness in the small things. You don't need to have everything all the time to feel happy.
That's true. That's very true. And with that, we have come to the end of today's session. And thank you so much, Dr. Rahul, for spending your precious time and just enlightening us with so important things, which are so important. But from doctor's point of view, it becomes entirely different. So thank you so much once again.
And one thing I want to emphasize regarding the
Yeah.
physical health also.
Right.
Basically, it's not that you have to go for hit the gym every day and do rigorous exercises and build your muscles and take the protein intake. It's 30 minutes of walking,
Right.
stretching, or
Right.
even doing yoga and meditation is enough.
Okay. 30
So,
minutes
but
we
but
have to
but
dedicate
that should be not negotiable. It has to be done every day.
every day. That's okay. That's very
So
important. Okay.
definitely.
All right. Thank you so much, Rahul. Thanks for your time.
Thank you, Devika. Thank you for
Okay.
inviting me.
Okay. So with this, we have come to the end.